I do Irish dance and I've been doing it, this is my 8th year. I've been doing it since I was 5 and I really like it just because it's different from everything else. I started doing ballet, tap and jazz and stuff like that, but then we had to choose between the two and I wanted to go with Irish dance because I felt I had more opportunities in Irish dance than I did in the other kind of dance. My sister broke her foot and so she had to go to physical therapy and that was one of the closest places. And so we knew Sam from that, and she talked to us about this dance program that could help us build strength and muscles and stuff that we need to work on. And so that's kind of how we knew about it.
So I met Katie. She came to us through a dance wellness screen. She had known that I had treated several Irish dancers in the past, and she really was on the preventative side of things. She didn't want to get hurt, and she wanted to make sure that everything that she was doing, she was as strong as she absolutely could be. We evaluated her postural alignment. We tested her strength, upper extremity and lower extremity. We looked at specific flexibility and range of motion testing, and then we also do some functional testing to look at their balance and the way that that plays into Irish dance.
She tested me on my weak areas, and then she gave me different exercises and different stretches to do every day and repeatedly. That way I could build up strength in those areas, which helps me prevent injury and how to properly prepare to go on stage or go to a practice without not being warmed up.
Katie, I remember she had a little bit of difficulty with ankle stability. Being an Irish dancer, they pretty much just dance with their feet. That's all they pretty much use. So what we did with her is that we gave her some ankle stability exercises, going up into a heel raise and shifting over to just one leg and seeing if she can balance in that heel raise position. No upper extremity support. We also gave her different perturbations to make sure that she was able to maintain that, and putting her on different surfaces to make sure that her ankle stability was strong enough.
So it really helped me because it helped me understand different things that I'd never really thought of before, different things I've never seen, but really helped. And I feel like having that one-on-one attention with Sam was beneficial. That way I wasn't in a class with a bunch of people I knew what I had to work on.
What I want to stress to dancers is that there is a way to stay healthy. Your body is your tool. That is what you use when you dance. It's just like taking care of an instrument if you're a musician. You have to make sure that it stays finely tuned. And that's what I stress to these dancers, is to make sure, hey, if you want to keep dancing, this is your instrument. This is what you have to keep up and make sure that you do everything that you can to keep it working as it should.